Hello, good day. Welcome back to yet another episode of Beyond the Stethoscope, where we discuss with medical professionals not about disease or hospital setting, but about their personal and professional life. Today, we are together with one contemporary nurse.
Good day. I'm Nurse Abubakar B. Halilu. I'm a perioperative nurse from Registered Perioperative Nurse University Hospital in Jigawa State.
Thank you. We are happy to have you. So please, how do you end up being a nurse? Is it your desire or do somebody influence you?
Okay, I always wanted to be a medical practitioner when I was young. So I later, when I graduated from secondary school, I wrote down I wasn't opportunity to be admitted for NBS, so I opted for basic nursing, which I studied basic nursing at College of Nursing in Jigawa State. So I was now then happy to become a nurse, because when I was into the nursing, I now realized how beautiful the nursing profession was.
Beautiful. So how can you remember and tell us, how do you feel on getting your admission letter? Was it a joy, relief, or a panic?
Yeah, it was a joy, because I was very happy, because I was struggling to get admission into nursing. Before then, I was studying at a polytechnic. So when I was called for an interview, I was so happy. Because I have had a chance to become a medical practitioner. So I was very happy actually.
Understand. Do you think the nursing college has adequately prepared you for what is happening in real life in the hospital setting?
Yes, of course, because where I studied, that is College of Nursing, Jigawa State. They prepare us very well, because immediately you enter the school, when you started basic nursing program, after 3 years, after 3 months of your study, they will start posting you to the hospital for you to see the reality of the hospital itself, for you to prepare yourself on the outcome, on what you need to deliver in hospital. So we actually be prepared by our dedicated tutors and lecturers.
That is excellent. So if there is one course, one subject you are capable of adding into the curriculum of nursing, be it ethics, guidance and counseling, finance, communication, which course will you add to the nursing curriculum?
Okay, the nursing curriculum is a vast curriculum that covers so many areas. I think if there's anything I will need to add, maybe let's say nursing, maybe they should do a course nursing and politics, for example. So that nurses will become into participating in politics. But I think the nursing curriculum has covered so many areas that I think
it will be nursing and politics.
Yes.
Okay. Mr. Abubakar, at what point did you feel in your body, yes, now I am a nurse?
Okay, this is a very beautiful question. As I told you earlier, our school usually post students after 3 months of their stay in school. Immediately you were admitted, you start lecture for 3 months, you now start posting to the hospital. So I was posted, I think at 6 months, 6 months after studying. We call it a first semester. So after the first semester, you start posting to the hospital. So we started posting earlier. So at this point, I realized I'm a nurse. It was when I was posted night duty to a general hospital as a student. Then the staff nurse that was working there now said, he's leaving me, he has an issue that he wants to take care of. Please, I should handle the ward. So I now look at myself. I'm the only individual that's taking care of the whole patient here. That was, I think, male ward, surgical and medical ward. I was like, okay, I can handle this case. I handled the whole patient to the next morning, and then the other day he now said, yes, I can do it. I should still do it again. I was like, so I'm now a nurse. That was my second year of being a student nurse. So at that stage, I realized I'm a registered, I am a competent nurse. From that time, yes.
And okay, what is difficult patient to you, and do you have any encounter with a difficult patient in terms of interaction, and how did you deal with that?
Okay, well, actually I have, I think there are many, but let me state maybe two or three. There is one time I was working at a certain hospital at community unit. So I take over duty, I think evening duty, that was in the afternoon. So I go through the folder and I realized there's a patient that was supposed to take a certain medication, of which there was not sign that the medication has been given to the patient. So I went to the patient, I asked, they said no, they have not given any injection. I said, okay, let me give the injection. Not knowing that the father of the patient has already been revoked. So he later come back and met me serving the injection. It was like, had he been, he did not come and see me in his patient bedside, I could have received some hot slaps. I was like, why? He said, because this patient has been febrile and there's nothing that has been done to him. I was like, it's my responsibility to do it. If not, the way he sound to me, I will have not do it. But because the patient, his word is not supposed to interfere with my professional activity, so I have to serve the patient. So I did what's supposed to be done. I left the patient. And another encounter was...
So because he is not the patient,
he's
so
not
if
patient.
you are being provoked by his word, you will leave the patient, which the patient has not done anything bad to you.
Yes, the patient has not done anything bad to you.
So you continue with your
Then there is one other patient. I think I was working in the emergency. Two patients came. The first one had a complaint of febrile headache and I think just minor complaint, mild abdominal pain as well. So when I was taking the data, another patient now rushed another patient to the unit. So I quickly left that patient. You know, there's something we call trial, so you need to check the one that needs more attention urgently. So I realized this patient is convulsing, and then the patient is pale. It was a child. So I left that patient to attend to this one that is more emergency. Yes, emergency. So the other relative of that patient now come to me that this is what, like, I'm being biased. He confessed, and I said, no, please. In fact, initially I wasn't even talking to him. I quickly requested for PCV and then MP some investigation. So I rushed. In fact, I followed them to the lab. Yes. So when we cross-matched, we collected blood and come back. When I start setting the blood, before I could even insert the cannula, the patient has passed away. So then that was when that was when I had time to explain to that patient that this patient needs more attention, need urgent attention than his own patient. So I now come and inform me, and I take him to the patient that passed. So I asked him that. I told him that this is what happened. So this patient needs more attention than your own patient. Look at your patient your patient can walk, your patient can talk. So I have to educate him on what we call the triad. So he later realized, and then he apologized. He apologized to me. And then I think this is one of the experience. Then there's another experience. I was working in an immunity ward again. So I was just sitting down in my nursing station. So one patient's relative. No, initially somebody told me, I don't know, I cannot remember whether a patient relative or a staff, that so people that are in that room, I should take care of them better because they are. He
knows them that they are difficult.
Yeah, they are difficult to handle. So I said, okay, fine. So I continued my work. He left. Then I was working in the nursing station. One of the relatives for the patient just come to the nursing station. He looked at my television set, it wasn't on. So he said to me that, thank God for me that my television set are not working. If not, I could have paid for, because their own television set has not been working since when they get admission to the ward. Meanwhile, they had paid for amenity. So I was not supposed to be enjoying a television while them that had paid are not enjoying anything. So I was like, what is it? He said he just left me and
so he was angry because their own television set was not working. So You were lucky that your television set was
not
not.
working. Yes, if not, I don't know what he would do to me. I was
So if I understand, a lot of people that been admitted to amenity, a lot of times they are difficult patients.
Actually, most of the patients that are admitted to amenity, maybe even if I myself think I'm good, because you pay a lot of money. So when you pay a lot of money, you are paying for some social amenities that are supposed to be maybe the television set, maybe you need maybe AC, you understand? Maybe you need fridge, good toilet, you understand? So if there's
special treatment,
you will feel why are you paying? So that thing triggers, and accompanied by the situation whereby you have a patient, that stress. You have a patient, maybe the patient is not recovering so well, so you are not too okay. Even your mood. So small thing can trigger your anger. You understand? So that's
thank God you have not collected the hot slap.
Yes, I don't collected. I don't collected the hot slap.
So now, what can you advise other healthcare providers about handling difficult patients in terms of social interaction?
Okay. Yes, I think the most important thing someone you are doing, you need to exercise patience. There are some instances whereby you need to understand the cultural, like the culture of a certain group of people where you are practicing, because knowing that will help you to, for violating their culture sometimes lead to what? Lead to
provocation.
Yes, you provoke the patient. So you need to exercise patience, and then whatsoever you are doing, make sure you are doing the right thing. Don't consider maybe patient might be forcing you to do so and so. Don't do it. Just do what you think. Like just do the best.
Nursing profession is actually a highly demanding profession. It requires your mental and physical commitment. So yes, almost everything. So what is one or two things that help you in resetting and regaining your strength after being absorbed by hospital setting? What gives you some reset?
Yes. Okay. Actually, I would say sleep. That is, yes. Apart from sleep, I engage myself in some sport activities like football and volleyball. Football is very very serious. When you are stressed out from work, and let's say you, like, when you are in the field, you enjoy playing football, or sometimes even watching the football. Watching football can also take out stress from you.
That is beautiful. Okay, have you ever had any problem with patient in regard with consent, counseling, or preparation for surgery?
Yes, I had several problems. There's one that happened not too long ago. There's a patient that was cancelled for emergency CS and then BTL. We call it bilateral tubal ligation. That's a permanent method of family planning. After that, patient cannot conceive again. So the patient consented, and then when they rush the patient to the theater, what we do, we reaffirm that the patient consented and he knows what he's consenting to. So some patient, sometimes we healthcare providers, sometimes let's say we can be lazy enough to, like, not inform the patient what is it, like, what we are supposed
like we may
we're
not
given
go
let's say
we
we are
may
not
not
given an informed consent.
okay, we may not go as low to the level of his intelligence. For example, you may give counseling to you may try to get consent from somebody who has finished secondary school.
Yes.
And somebody who has done his first degree or masters. There
There are
are three. You understand? So we sometimes you mean we don't go as low as their level.
Yes.
For example, somebody who has just finished primary school, he doesn't know anything about BTL. So we have to start with BTL. Then what is BTL? Then explain what it does, maybe in their local language.
Yes,
I understand.
yes.
Okay.
Yes. So issue of consent, especially during surgery, is one of the most important aspects to look at.
Yes.
We prepare the patient in the ward. we make sure that the patient has signed an informed consent. A consent can be informed when the patient knows the procedure. That is one. Two, the benefit of the procedure. Three, the risks, possible risks and possible complication of that procedure. And then there's one other thing that we disregard. Patient need to know the alternative procedure for that.
Understand. If he say no for that one, okay, is there any other?
You need to know. Like, he don't need to ask you. You need to tell him that if you don't want this social procedure, there's another alternative for you.
I understand.
So you need to know. So this is an informed consent, of which sometimes patients are not getting informed consent, maybe from the ward or maybe
in all the.
So ideally, the surgeon needs to talk to the patient, obtain an informed consent with witnesses. So when they came, what I do, I usually in my own personally, I usually
go again.
I go again. I ask the patient whether he knows about
the procedure.
Somebody would, maybe let's say for example, a woman might come for CS. She knows she has a baby. The baby is there, and then I will not be asking her, what do you think we are doing for you? Then she'll be like, I'm still asking, like as if I don't even know what I'm doing. So she will not tell me that CS. Sometimes they will even answer you the way you understand,
carelessly.
So I will have to ask. So that woman came. I checked, and then there was BTL. If it is male CS, sometimes but when I saw BTL,
it's serious.
It's serious. So I now asked the patient, what procedure? She said, yes, CS. And I said, apart from CS, she said nothing more. I said, how about, do you know anything like BTL, like tubal ligation? We call it all the my father is
in local language.
And she said no. She was shocked that no. She's not supposed, like, she no consented for that. That was in the red line in the theater. So she said she no consent for that. So I said, you no consent. She said no.
Then you get in to communicate with the surgeon and that thing.
Yes, I communicated to the surgeon that your patient did not consent. But he said she has consented. They have witness. The witness are the relatives. I said, okay, let's call the relative. We call the relative. The relative said yes. She has got. They have convinced her and she consented in the word. Maybe I don't know whether she's not fully aware of what it, because I told her, maybe they have told her that they will do BTL, you understand?
But they did not translate the word.
They did not tell her that this is a permanent method of family planning. Maybe she'll be thinking later she may likely come back and maybe they should remove that procedure and then maybe she will conceive. So I told her this is it. I now told her that after this procedure she don't have any chance
for conceiving.
So that was when she came back to her senses and no. So we called her relative and the husband. She said she would not consent. Then they now asked us that we should allow them to convince her, of which we don't obtain that kind of consent in the theater. You understand?
Yes.
So we said we are within CS now, and then later she should come back for when she has fully consented. Then she should now come back for BTL. The idea for the BTL was, I think, is the best idea for her because she's having hemiplegia. Somebody that has hemiplegia, I don't think it's okay for her to.
And how many
she has children? She has 4 children. That baby is the 5th baby. So I think she has children enough. So she last we did not do the BTL. We really do our emergency CS and then we let her. Yes.
Okay, I understand. She has hemiplegia and she has 4 children. And there's one critical thing about consent that has to do with permanent method of family planning. From a perspective of medical data, we must give 1 week. 1 week. Okay, you bring the couple, both the male and the lady. This is the procedure we are going to do, and this is how it's going to be. It is a permanent way. For example, for the lady, you have to tell her all the risks. For example, that couple, they may go their own way. They may get divorced. One may die and live. So you have to tell them all the risks. Then On that spot, you cannot accept their consent.
You cannot.
Okay, you know he may divorce you, for example, literally. He may die. You tell him also, okay, this is the way. For example, he may need more children. So you tell them, then you let them go for a week. Let them go and discuss at home. Then 1 week later, they can come back and give you their consent.
About the consent a week.
Mm.
There's one I now remember a patient that came. The patient is a DM patient and she had CS and then she had some complications. So the wound does not heal. So they now brought the patient for debridement and then secondary closure. So when the patient came to the theater on the table, on the theater table, she was now saying, please, we should do permanent family planning method.
To remove the womb.
We should either remove the womb or we should do that BTL I was talking about, bilateral tubal ligation. The tubes should be ligated. So she was pleading with us that we should do that because she has been suffering with that. She has given back, I think, it was 2 weeks after delivery, but she's still in pain. She don't even know when the wound will heal, so she don't want to conceive anymore. So she was pleading, and we cannot do that because that was she want to consent on the table. We cannot do that. We have to give her time. So we have to convince her that she has to go home,
think about it, discuss with her couple,
her spouse. That's what we did to her. So we don't take consent, especially type of consent in the theater. No, we don't do that.
What give you most satisfaction? You being a nurse, for example, you can just be minding your business in time. Just go. Let's say you go through market. Hello. Somebody will recognize you. So that can be recognition, that can be respect, that can be money. Although I know there is not much money in there. So what give you most satisfaction?
Actually, when I was working in AIE, in AIE, you have patients that will come to you with complaint of maybe abdominal pain, some injuries, RTAs, road traffic accidents.
Yes.
You find patient in distress. So what gives me joy is when a patient comes with distress, maybe abdominal, patient has been turning around, then I'll make some treatment and then the patient will become stable, laughing to you, understand? So that gives me joy. Patient will thank you. In fact, there's one, some of us that know urine retention.
Yes.
Some patient that will come up with urine retention. Patient is unable to pass urine and then the bladder is filled. So there's any procedure you give to the patient, maybe just merely inserting catheter. Immediately start draining that urine, patient will be at ease. The joy a patient you have delivered something. You understand? The patient will be happy, praying to you. Sometimes you have to do cystotomy for a patient to get all those procedures that you will do that you have instant relief for a patient. Yes. I love that procedure. In fact, not praying, but sometimes if the patient come along with abdominal pain, I will just be looking at them. I will just do some prayer to God, and then patient will be fine. So that is what gives me joy. And then sometimes you will just be passing by, and then the patient will just see you. Nurse, so. Hello, there's a nurse. I cannot forget this. I think it's a Fulani man. Yes. I treated the patient. I treated his relative for him in the hospital. So I was just passing by. He saw me. He called me. He don't even know my name. Yes, but he was now trying to narrate to me. I treated his patient like I was supposed to remember. The patient are much, so I couldn't remember. He was like, he thanked me so much. Wow. He brought 100 naira. Wow. I think that was around 2016 or 17.
And maybe that is all money he has in his body.
He brought 100 naira and gave it to me. I said, no, I did it for the sake of God, and that is my profession. He said, I must collect. He insisted. He was like, I don't want to collect because the money is too low for me. Like maybe
I understand.
And he said, that is what he can offer to me. I said, you should not worry, let him pray for me. That was when, and there's one certain time I treated a patient in AIE. I think 2 times. One, a lady brought her mother and I treated the mother. They were happy. She left. Then I was on duty some days. Somebody brought, that time we have plenty of patients. I have several cards with me. Time of prayer, I have to skip the prayer. So I now say, I now give the card to my colleague, telling him that I want to go and pray. Immediately I left the office. Then one of the patients that was waiting for me come to me and said she come all the way from their village to see me. She thank God that she saw me. So I now give the card to somebody that she don't want to see, not because she's saying that he's not. And I said
just based on experience.
Yes, I said that is my senior colleague. I told him that person that is my senior colleague. He can do better than me. She said no. She wants to see me. That was, in fact, if I don't have her time, he should go back. So I said, okay, she should know what is her name. I check, I took her card, and then I checked, I review her, and then I give her drug, and she left. So there are some instances that you feel, yes, you are delivering something actually. Yes.
So do you have any colleague you try to communicate with when you have a difficult case?
Yes, I do. Actually, not only in nursing profession, there. In fact, apart from my own experience, I will share another experience. When I was a nurse, newly qualified nurse, I was posted to AIE. So any kind of case, any type of case, I'll just bring it to you. And then we don't have medical doctor there. You are the alpha and omega as a nurse. So immediately they bring a case, and we have some senior colleagues that are working in the ICU. So I quickly rushed to them. You said, this is very simple. Just do so and so. Sometimes I take the patient. In hairstyle, if you don't know something, you don't know it.
Yes.
Don't do based on.
Yes.
So you just don't. So when I feel I don't know, I'll just take a patient to a senior colleague, and I have somebody that I call on phone. I can call him on phone. I have two. I have Kabiru Ubali. I can just put a call to him, and he will tell me what to do. I have so many senior colleagues that I call, of course. Then I have another experience that I just wanted to share about calling superior. You understand? Yes. There's when certain time we are performing surgery to a patient. We are doing expiratory laparotomy. So the surgeon was an XR. Then when you are maybe a senior colleague or a health professional, your phone needs to be on at all times, because a call, just 2-minute call, can save somebody's life.
Actually, I had a saying. They said if you are being called, you are a medical professional, and you are being called, especially in the night, it is either you are needed to save someone, or someone needed to save you.
Of course. So actually, my life, when I want to sleep at night, I check my phone and make sure that the phone is not on silent mode. That is me. But when it's during the day, maybe I want to take a nap at night, at afternoon hours, I can put my phone on silent or something. But once I want to sleep at night, I remove my phone from silent. I don't put phone on, because I know emergency calls can come. So there's one thing I wanted to share. We are performing surgery, so we need alternate opinion. We need a superior opinion. So the surgeon was an SI. He called one of his profs. Just imagine you are sleeping with your wife, and then somebody's calling you video call. We have to call him video call for him to see what we are doing, and then let him suggest.
My goodness.
You understand? So it is actually very important. That SR is a very good somebody, because what he was doing, what he intended to do, that was what they told him to do. But he really needs some alternate.
I understand.
Yes. So he has to call. He called him voice call, and he said, let him switch it. Video call. Video. The SR requested that, please sir, I want you to see it. That was around 2 a.m. He called it video call. Imagine somebody is sleeping at home. He called it video call. He saw, and he gave us his decision, and then we performed surgery. So actually, when you are in difficult situation, I'm advising, not only difficult situation, when you are in a situation whereby you indecision, so please call somebody. Call somebody. It always pays.
Beautiful. Did you ever had a needle prick or a cut after using the instrument to a patient?
Yeah, I had one needle prick that was I was inserting catheter to a patient. I thank God the patient is pediatric, that is a child. So I inserted the cannula. When removing the needle from the needle goes straight down. You know, actually we are supposed to be putting on cover shoes. That is the normal.
Yes, yes, yes.
That day I was putting on a palm, so I had an injury. I sustained an injury in the other leg, so I didn't put on cover shoe. So when I removed that needle,
Troca.
the trocar, it go directly and puncture my leg, and then it stands stick like this. So I was like, I look at it, I look at it, and then look at the patient immediately, and then
And his mother was okay, serology all negative. Okay, beautiful.
You know, the first thing you should do is to check for the serology.
Yes,
So
yes.
I have to do that, and then it was okay.
Okay, so
Yes,
fantastic.
yes.
Okay, I think that is all we have. Do you have any questions for me?
Actually, I don't have any
Okay,
question.
beautiful.
Yes.
Okay, so nice to have you. Thank you so much.
Thank you so much. Nice to have you too.
This brings us to this episode of Beyond the Stethoscope. We wait to see you on the next episode. Thank you.